Most people believe pancreatic cancer is something that just shows up suddenly, with no warning, no signals, and nothing you could have done about it. That belief is not only wrong, it's dangerous. Because here's what actually happens inside the body. Pancreatic dysfunction is usually slow, silent, and metabolic long before it becomes life-threatening. The pancreas doesn't fail overnight. It deteriorates through years of insulin imbalance, inflammation, and digestive disruption. My name is Dr. Zeno Phantom, and I've been practicing medicine for over 15 years, focusing on metabolic and digestive disorders in aging populations. I still remember one patient clearly, a 68-year-old retired male school principal. He came in with mild fatigue, occasional back discomfort, and unexplained weight loss of 7 kilograms over 3 months. He thought it was just aging. Blood tests initially looked normal, except for slightly elevated fasting glucose. But within 6 weeks of further imaging, he was diagnosed with stage 2 pancreatic cancer. Despite intervention, his condition progressed rapidly, and within 11 months, his weight dropped from 74 kg to 52 kg, and his energy levels declined by over 60%. Today, I'm going to show you exactly 8 early symptoms of pancreatic cancer in seniors that most people completely ignore, and how to recognize them before it's too late. According to the American Cancer Society, pancreatic cancer has a 5-year survival rate of only about 13%, largely because it is detected late in most patients. That's the real problem. Not the disease itself, but the delay in recognizing the early metabolic warning signs. Most people miss this because they assume symptoms like fatigue, bloating, or appetite changes are just normal aging, but they are not. They are signals from a failing metabolic system, especially the pancreas, liver, and insulin network. And in the next sections, I'll break down exactly what those signals are, what's happening inside your body at a physiological level, and what you can start doing immediately to protect your metabolism, energy, and long-term survival. Before we go into the 8 symptoms, you need to understand the underlying metabolic pattern, because pancreatic cancer doesn't start as cancer. It starts as dysfunction. Here are the 6 core physiological insights we will build everything on. Insulin resistance silently damages pancreatic cells long before symptoms appear. Chronic inflammation creates a toxic environment that disrupts digestion and cell repair. Subtle digestive enzyme failure leads to nutrient malabsorption and unexplained weight loss. Blood sugar instability is often the earliest metabolic warning signal. Bile and liver-pancreas communication breakdown causes bloating and fat intolerance. Nerve compression and tumor microgrowth can create referred pain in the back and abdomen. Now here's what most people don't realize. The pancreas is not just a digestive organ. It is a metabolic control center, regulating insulin, glucose, and digestive enzymes simultaneously. So when it begins to fail, the body doesn't scream immediately. It whispers through metabolic imbalance first. Let's use a simple whiteboard idea. Think of your body like a city: the pancreas, central power station, insulin, electricity distribution system, digestive enzymes, waste processing units. When the power station starts malfunctioning, the city doesn't collapse instantly. First, you see flickering lights, slow waste removal, and unstable energy supply. That's exactly what early pancreatic disease looks like. What makes this dangerous is that most seniors misinterpret these early signals as normal aging, stress, diet issues, acid reflux. But physiologically, these are early breakdown patterns in glucose regulation, enzyme production, and inflammatory control. Research from the National Cancer Institute highlights that pancreatic tumors often develop silently for years before diagnosis, meaning the metabolic warning phase is the only real opportunity for early detection. And that is exactly what we are going to decode next, starting with the first symptom that almost always appears long before diagnosis, but is almost always ignored. Symptom 1. Unexplained weight loss, plus loss of appetite, and this is often the first silent red flag. Almost every patient I've seen with this says the same thing. I'm just eating a little less because I'm getting older. Or, my metabolism is slowing down, so I guess this is normal aging. But that assumption can be misleading, especially in seniors. Here's what's actually happening inside your body. The pancreas produces enzymes that break down fats, proteins, and carbohydrates. When pancreatic function begins to decline, food is no longer properly digested or absorbed. So even if you are eating normally, your body is essentially starving at the cellular level. At the same time, cancer or precancerous changes can shift metabolism into a hypercatabolic state, meaning your body starts breaking down muscle and fat for energy. This is why weight loss becomes rapid and unintentional. Let me explain this with a simple analogy. Think of your body like a delivery company. Food is the package, and enzymes are the delivery trucks. If the trucks stop working, packages pile up in the warehouse, but the stores, your cells, never receive supplies. The company looks busy, but no deliveries are actually happening. That's what malabsorption feels like internally. According to the American Cancer Society, more than 70% of pancreatic cancer patients report unexplained weight loss at diagnosis, often before other major symptoms appear. My recommendation for every patient over 60, track your body weight once weekly under the same conditions. If you lose more than 2 to 3 kilos without effort in a month, pair every meal with enzyme-supportive foods like papaya, fermented vegetables, and adequate protein intake spread evenly across the day. Also avoid skipping meals. Prolonged fasting in this state can accelerate muscle loss. This is not just aging. This is metabolic decline signaling dysfunction, and the earlier you notice it, the more reversible the pathway becomes, not next month. Today. Symptom 2. Persistent upper abdominal pain or back pain. And this one is often mistaken for simple posture issues. Almost every patient I've seen with this says, "It's just my back, I probably slept wrong," or "It's arthritis from aging." They treat it with painkillers, heat pads, or ignore it completely for months. But that assumption can delay a critical diagnosis. Here's what's actually happening inside your body. The pancreas sits deep in the abdomen, behind the stomach, and close to the spine. When inflammation, swelling, or a growing lesion develops, it can irritate surrounding nerves, especially the celiac plexus and spinal nerve pathways. That's why pancreatic pain often doesn't stay in one place. It can start in the upper abdomen and radiate straight through to the mid-back. Unlike muscular pain, this type of pain is deep, dull, and persistent. Worse after eating, not fully relieved by rest or position changes. This is a nerve referral pattern, not a muscle problem. Let me explain this with a simple analogy. Think of your pancreas like an electrical transformer box embedded in a wall. If the box starts overheating or malfunctioning, the issue doesn't just stay at the box. The wiring connected behind the wall starts sending faulty signals into different rooms. You might feel it in the kitchen, even though the problem is hidden in the wall behind you. That's exactly how pancreatic pain behaves. Hidden source, distant signals. According to research published in the World Journal of Gastroenterology, up to 80% of pancreatic cancer patients experience abdominal or back pain at some stage of disease progression, often months before diagnosis. My recommendation for every patient over 60: if you notice persistent upper abdominal or mid-back discomfort lasting more than 2 weeks, do not rely on painkillers alone. Track timing, especially whether it worsens after fatty meals. Support digestion by reducing heavy fried foods, eating smaller, more frequent meals, adding gentle movement, 10-15-minute walk after meals. These reduce pancreatic workload and improve digestive flow. Back pain is common, but this pattern is not random. If it persists and behaves this way, your body is asking for attention, not next week, tomorrow. Symptom 3. Yellowing of the skin or eyes, jaundice. And this is one of the most visually obvious signs, yet still ignored. Almost every patient or family member says his eyes look a bit yellow because he's tired, or it must be a liver issue from diet. They often assume it's harmless, temporary, or related only to dehydration or aging, but that assumption can be dangerously incomplete. Here's what's actually happening inside your body. The pancreas sits very close to the bile duct. the channel that carries bile from the liver into the intestine. When a tumor or swelling develops in the head of the pancreas, it can compress this bile duct. As a result, bile cannot flow properly. Instead, bilirubin, a yellow pigment from bile, starts building up in the bloodstream. This causes yellowing of the eyes and skin, dark urine, tea-colored, pale or clay-colored stools, itchy skin due to toxin buildup. This is not a skin problem. It is a bile drainage failure. Let me explain this with a simple analogy. Think of your liver and pancreas system like a city's drainage system. The liver produces waste fluid, bile, and the bile duct is the main drainage pipe that carries it out of the city. If that pipe gets compressed or blocked, waste doesn't leave the system. Instead, it backs up into every part of the city's water supply, turning everything yellow and contaminated. That's exactly what jaundice represents, a backup of internal waste circulation. According to clinical findings published in the Journal of Clinical Gastroenterology, approximately 50–70% of pancreatic cancer patients with tumors in the pancreatic head present with jaundice as an early visible symptom. My recommendation for every patient over 60: check your eyes in natural light once daily. If you notice a persistent yellow tint, especially with dark urine or pale stools, do not delay evaluation. Support bile flow by staying well hydrated, 2.5 liters daily unless restricted. Reducing fried and high-fat processed foods, including bitter greens like arugula, fenugreek, and dandelion tea in moderation. These help maintain liver bile efficiency, but they do not replace medical evaluation when jaundice appears. This is one of the clearest visible warnings your body can give you. If this is helpful so far, consider subscribing. I post content like this regularly to help you understand early metabolic warning signs before disease progresses. And remember, jaundice is not a cosmetic change. It is a system-level signal, not next month. Today. Symptom 4. New onset diabetes or sudden blood sugar instability. And this is one of the most misunderstood early warning signs. Almost every patient says, "I just developed diabetes because I ate too much sugar over the years." Or, "It's just age-related insulin resistance." But what many people don't realize is that sometimes diabetes is not the cause. It is the consequence of pancreatic dysfunction. Here's what's actually happening inside your body. The pancreas contains beta cells that produce insulin, the hormone responsible for moving glucose from your blood into your cells. When pancreatic tissue becomes inflamed, damaged, or compressed, insulin production becomes unstable. This can lead to sudden onset of high blood sugar in someone who was previously normal, worsening glucose control despite no major dietary changes, frequent fluctuations, high after meals, low between meals, fatigue, brain fog, and increased thirst. In some cases, pancreatic tumors directly interfere with insulin secretion or glucose metabolism, creating what doctors call secondary diabetes. So the key point is this: not all diabetes starts in the diet. Some starts in the pancreas itself. Let me explain this with a simple analogy. Think of your pancreas like a thermostat controlling room temperature. Insulin is the signal that tells your body when to cool down blood sugar levels. If the thermostat starts malfunctioning, the heater and air conditioner stop responding correctly. The room temperature swings wildly, sometimes too hot, sometimes too cold, even though nothing in the room itself changed. That's what unstable blood sugar feels like internally. According to research published in the Journal of the National Cancer Institute, up to 50% of pancreatic cancer patients may show new-onset diabetes within 1 to 3 years before diagnosis, often without classic risk factors. My recommendation for every patient over 60: if you are diagnosed with diabetes after age 50, especially without obesity or long history of metabolic syndrome, treat it as a deeper signal. Track fasting glucose trends, post-meal spikes, 2 hours after eating, energy crashes after carbohydrate meals. Support stability by prioritizing protein and fiber in every meal, walking 10–15 minutes after eating, avoiding refined carbohydrates on an empty stomach. This improves insulin sensitivity and reduces pancreatic stress. Sudden diabetes is not always just a lifestyle issue. Sometimes it is the pancreas asking for help, not next month. Today, Symptom 5. Persistent bloating, indigestion, and fat intolerance. And this is often dismissed as simple stomach issues. Almost every patient says, "It's just gas," or "I ate something heavy and my stomach is slow." Many assume it's lactose intolerance, acidity, or just age-related digestion slowdown. So they start antacids, probiotics, or avoid random foods, without understanding the root problem. But in some cases, this is not a stomach issue at all. Here's what's actually happening inside your body. The pancreas produces key digestive enzymes, especially lipase for fats, amylase for carbohydrates, and proteases for proteins. When pancreatic function begins to decline, fat digestion is often the first to fail. That leads to bloating after even small meals, greasy or floating stools, nausea after fatty foods, a heavy, stuck feeling in the upper abdomen. Undigested food doesn't just sit there harmlessly. It ferments in the gut, producing gas, inflammation, and discomfort. So the real issue is not too much gas. It is incomplete digestion at the enzymatic level. Let me explain this with a simple analogy. Think of your digestive system like a washing machine. Food goes in like dirty clothes. Enzymes are the detergent and water pressure that clean everything properly. If the detergent is missing or weak, the machine still runs, but the clothes come out partially dirty, heavy, and poorly processed. That's what pancreatic enzyme deficiency feels like. The system is working, but the breakdown process is incomplete. According to research in the World Journal of Gastroenterology, pancreatic enzyme insufficiency is present in up to 80–90% of patients with advanced pancreatic disease, often manifesting first as fat malabsorption and bloating. My recommendation for every patient over 60: pay attention to how your body reacts specifically to fatty meals like fried foods, cheese, or heavy oils. If symptoms consistently worsen after fats, switch to smaller portions of healthy fats, olive oil, nuts, seeds. Eat slowly and chew thoroughly. Mechanical digestion matters more than people think. Take a 10–15-minute walk after meals to stimulate bile and enzyme flow. Also, avoid constantly suppressing symptoms with antacids because they don't restore enzyme production. If your digestion is becoming more unpredictable over time, your body is not just aging, it is changing functionally. If this is helping you understand the deeper picture, like the video and subscribe, because the next symptoms are even more subtle, but far more dangerous. Not next week, today. Symptom 6, loss of appetite. Early fullness, feeling full after a few bites. And this is one of the most deceptively normal symptoms. Almost every patient says, "I just don't feel as hungry anymore," or "I get full faster because my stomach has shrunk with age." Some even think it's a positive thing. "I'm eating less, so I'm healthier." But in metabolic medicine, this pattern is not always harmless. Here's what's actually happening inside your body. The pancreas is closely connected to the stomach, intestines, and vagus nerve signaling, the communication system that tells your brain when to feel hungry or full. When inflammation, tumor pressure, or enzyme disruption begins, several things can happen. Delayed stomach emptying, food sits longer than normal. Disrupted digestive hormone signaling, like CCK and ghrelin imbalance. Mild pressure effects on nearby organs that alter appetite signaling. As a result, the brain receives a false message: we are already full. Even when very little food has been eaten, this leads to early satiety, feeling full after just a few bites. Over time, this creates a dangerous cycle. Less food intake, weight loss, muscle loss, weakened metabolic reserve. Let me explain this with a simple analogy. Think of your digestive system like a fuel gauge in a car. Normally, the gauge tells you accurately how much fuel is in the tank. But if the wiring behind the dashboard becomes faulty, the gauge may show full even when the tank is nearly empty. So you stop refueling, not because the tank is full, but because the signal is wrong. That's exactly what disrupted appetite signaling feels like. According to findings published in the British Journal of Cancer, loss of appetite and early satiety are reported in over 60% of pancreatic cancer patients prior to diagnosis, often alongside unexplained weight loss. My recommendation for every patient over 60: if you notice persistent early fullness lasting more than 2 weeks, switch to smaller, nutrient-dense meals, protein plus, healthy fats plus fiber. Avoid liquid calories replacing meals. They do not stimulate proper satiety signaling. Eat slowly, without screens, to improve gut-brain communication. Light walking after meals can help normalize digestive hormone signaling. Also, monitor whether this symptom is progressing alongside weight loss. That combination is more important than either alone. Loss of appetite is not always emotional or age-related. Sometimes it is neurological and metabolic signaling disruption. Not next month. Today. Symptom 7. New or worsening diabetes, plus unexplained fatigue together. And this combination is often the most overlooked metabolic red flag. Almost every patient says, "I'm tired because I have diabetes," or "My sugar is a bit high, so that explains my fatigue." They accept it as a normal consequence of aging, stress, or poor sleep. But what they don't realize is that fatigue plus unstable glucose is sometimes not a diabetes complication. It can be a pancreatic warning pattern. Here's what's actually happening inside your body. When the pancreas is under stress, whether from chronic inflammation, enzyme dysfunction, or early tumor activity, two key systems begin to fail together. Insulin regulation becomes unstable. Blood sugar spikes and crashes. Energy production at the cellular level drops. Mitochondria receive inconsistent fuel. So even if glucose is high, your cells are effectively starving for usable energy. That's why patients feel deep exhaustion even after rest, brain fog that doesn't improve with sleep, heavy, drained feeling after meals, sudden energy crashes after eating carbohydrates. This is not just tiredness. This is metabolic energy failure at the cellular level. Let me explain this with a simple analogy. Think of your body like a power grid city. Glucose is the electricity supply, and insulin is the system that delivers it into homes. Now imagine the power lines are unstable. Electricity is available in the main station, but it's not reaching the houses properly. So lights flicker, machines slow down, and everything feels low power, even though energy exists. That's exactly what happens when pancreatic regulation starts failing. According to research published in Diabetes Care, fatigue is one of the most commonly reported symptoms in over 70% of patients with glucose dysregulation. And in pancreatic disease, it often appears alongside new onset or worsening diabetes. My recommendation for every patient over 60: if you experience both fatigue and blood sugar instability, eat protein with every meal to stabilize glucose response. Avoid long gaps without food if you are losing weight unintentionally. Take a 10-15-minute walk after meals to improve glucose uptake into muscles. Prioritize sleep consistency, same sleep and wake time daily. Also track energy patterns, not just glucose numbers. Energy tells the real story. When fatigue and blood sugar problems appear together, the body is no longer just tired. It is metabolically dysregulated. If you're finding value in this breakdown, consider subscribing, because the final symptom is one of the most advanced warning signals the body can produce before diagnosis. Not next week. Today. Symptom 8. Pale stools, dark urine, and sudden changes in bowel pattern. And this is one of the most overlooked digestive warning systems. Almost every patient says, "It's just something I ate," or "My digestion is a bit off lately." They often blame spicy food, travel, stress, or minor infections. Because bowel changes are common, people normalize them quickly. But there is a difference between temporary digestive upset and a structural breakdown in bile enzyme flow. Here's what's actually happening inside your body. The pancreas and liver work as a coordinated system. The liver produces bile, and the pancreas provides enzymes that break down food properly in the intestine. When the pancreatic head becomes affected, or when bile flow is disrupted due to pressure or inflammation, digestion changes at a very visible level. Pale or clay-colored stools, not enough bile reaching the intestine, dark urine, excess bilirubin being excreted through kidneys, greasy or floating stools, fat not being broken down, irregular bowel patterns, inconsistent enzyme activity. This is not a simple stomach issue. It is a failure of the bile enzyme digestive pathway. Let me explain this with a simple analogy. Think of digestion like a wastewater treatment plant. Bile is the chemical treatment agent and pancreatic enzymes are the filtration machines. If both systems are working properly, waste is processed cleanly and exits the system normally. But if the chemical treatment stops and filtration weakens, waste becomes incomplete, unprocessed, and visibly altered when it exits. That's what stool and urine changes represent: a breakdown in internal processing systems. According to clinical data published in the Pancreas Journal, changes in stool color and fat malabsorption are present in up to 70% of pancreatic head-related disease cases, often appearing before advanced symptoms develop. My recommendation for every patient over 60: pay attention to stool color and consistency for at least a few weeks, not obsessively but observantly. Support digestive flow by staying hydrated to maintain bile fluidity, including moderate healthy fats, olive oil, nuts, to stimulate bile release, walking 10 to 15 minutes after meals to enhance intestinal motility, avoiding very low-fat diets long-term, which can reduce bile stimulation. If these changes persist beyond 1 to 2 weeks, it should not be ignored or self-treated. Your body always communicates internal failure through visible output, especially urine and stool. When those signals change consistently, it is not random. It is systemic, not next month. Today. Now let's bring everything together, because the real danger of pancreatic disease is not that it appears suddenly. It's that it builds silently through metabolic disruption long before diagnosis. We walked through 8 key warning signals: unexplained weight loss, persistent upper abdominal or back pain, jaundice, new onset or unstable diabetes, chronic bloating and fat intolerance, early satiety with appetite loss, deep fatigue combined with glucose instability, and finally changes in stool and urine color. If you step back and look at this pattern, something becomes very clear. This is not a list of random symptoms. This is a breakdown of a single system, the pancreas, and its metabolic network. Here's the physiology behind it. The pancreas is not just a digestive organ. It is a dual control center for both digestion and blood sugar regulation. So when it starts to fail, 2 things collapse at the same time: nutrient breakdown, enzymes stop working properly; energy regulation, insulin and glucose instability. That is why the body begins to show mixed signals: weight loss with fatigue, diabetes with digestive issues, appetite loss with malnutrition. And most people misinterpret these signs as aging, stress, or diet issues. But now you understand the deeper pattern. It's not just symptoms, it's system failure. What matters most is timing. Early recognition gives you the chance to intervene at the metabolic level, improving glucose stability, supporting digestion, reducing inflammation, and protecting pancreatic function before irreversible damage occurs. So here is your simple challenge. Don't try to change everything. Just choose one signal you recognize today and start tracking it: weight, energy, digestion, or blood sugar stability. Because awareness is not passive, it changes outcomes. And if this added clarity to your understanding, like the video and subscribe, because the goal here is simple: to help you recognize the body's warnings early enough to act, not react. Not next month. Today.